disqualifying sound, but it's really important for the people that are listening through the Google Hangout. So, all right, let's get started. London.
This is actually their introduction, which...
Hi. Hello, we're here in London working on the Mimic database. Computer scientists and medical students and the surgeons here. What we're interested in looking at is something called the neutrophil lymphocyte ratio, which is a marker for inflammation, and we're hoping that it can be used to predict outcomes in the ICU patients we find in the Mimic database. And we'll update you with our progress over the next couple of days. Thanks.
Welcome.
Why did you say cheers rather than thanks?
All right, here's their presentation.
Hi, hello from London. Our team was interested in the neutrophil lymphocyte ratio, also shortened as NLR. White blood cell count is one of the useful inflammatory biomarkers in clinical practice, and although it is in normal range, subtypes of white blood cell count, like the NLR, are used to evaluate systemic inflammation. We found 4 relevant papers reporting results of prospective and retrospective studies conducted using cohorts of in-hospital patients. And neutrophil and lymphocytes and NLR have been shown to be important laboratory markers in the context of cancer and cardiovascular disease. We hypothesized that the addition of information about the neutrophil and lymphocyte ratio may predict adverse outcome in an ICU population. From the Mimic database, we selected all first admissions of adult patients to the ICU. As you can see, a large number of patients who did not have NLR data at admission were discarded, and we ended up analyzing a cohort of 5,200 patients, and we used the mortality at 28 days as our primary outcome. We extracted the baseline values of NLR together with many other variables at admission, which include, for example, the white blood cell count, some vital signs, comorbidities, and treatments and medication prescribed within the first 24 hours of the ICU admission. We conducted some exploratory analysis and univariate and multivariate analysis using logistic regression, for which we used the G-multi-R package to perform model selection using the archaic information criterion adjusted for the sample size. We evaluated the prediction power of the best model selected using the area under the ROC curve. We show here the histograms of the variables of interest in order to illustrate their ranges and the overall relationship between the neutrophils and the lymphocytes. In order to adjust for the confound factors, we ran the model selection algorithm for a few times, including the variables of interest and other baseline variables. And the selected variables identified by the method were selected for inclusion in the final model. They are represented here in this results table as the Hodge ratio and the level of significance. As you can see, the final model included age, SOFA, SAPS at admission, the chronic pulmonary comorbidity, the use of ventilation and vasopressors in the first 24 hours, but also the percentage of lymphocytes in the blood. According to our preliminary analysis, the lymphocytes information is kept in the multivariate model. We also compared the performance of our model with other systems on patients of the selected cohorts, and it achieved a better performance with a significantly higher AUC value, which encourages us to conduct further and more exhaustive analysis in order to demonstrate that neutrophils and lymphocytes add predictive value for ICU patients. Thank you for your attention, and we will be happy to get any feedback from you on this work.